Dr. Danyo. How are you doing, my friend? It's so nice to see you.
Clark, it's always great seeing you.
The
Always.
studio is still cruising along great for you over there. I love it.
Yeah, it's we got a great studio. What can I say? And had a lot of people work on it with me, and I'm glad that it's finally here.
It brings us a whole new dimension to be able to not only hear you, but really see the passion that you bring to your work. And, not too long ago, we are talking about how this is an art form when you're doing these procedures. And not only is it an art form, but you're bringing a lot of peace, right, to people's minds and their spirit. And I'm excited to talk a little about today. You do this, what's called a Shave-Less FUE, right?
Yes.
That's one of your specialties. And
Especially,
so I
yes.
do want to briefly touch on, hey, what is the Shave-Less FUE? If this is someone's first time, kind of just getting to know you and how you do things. But I really want to walk through, why someone should think about doing it, or maybe other options. Maybe we can talk a little about where the industry and the technology has been as well over the years. So
Sure.
to kick us off, though, what is a Shaveless FUE? That sounds a little overwhelming. What is that in your own words here?
So a shaveless FUE means that we do what's called follicular unit excision, where we take individual follicles from the head, not the strip where you end up with a linear scar, but we can actually do this without without needing to have your head shaved, which is big. Concealment.
100%. That is significant.
Oh, massive.
And that used to be what would have to happen?
Pretty much. And that really is kind of the norm in the marketplace. I mean, I do consults all the time, and patients either find us for the Shaveless FUE, and we have people from all over the country flying into our great town of Alpharetta to have it done. But I did a consult today, actually, and he said, I didn't even know that was an option. And he had 2 previous hair transplants before with his head shaved. And when I brought that up, he said, yeah, that's what I want, because, just getting back into work and social settings, it took a couple weeks, and it was a bummer. And, this whole hair loss thing is really emotional for most people. It just erodes their confidence. And then when they start looking into hair transplant on the internet, it's like the wild, wild west. I mean, it's so salesy, and everyone's got their own gadgets, and everyone has a different philosophy. But I can tell you from experience, I am one of the few doctors that actually performs the procedure. I'm talking extracting and placing grafts. This is unfortunately a very highly tech-oriented specialty, and so maybe the doctors own the clinic, but it's so frequent that I hear that the doctor didn't do the procedure. And a lot of times the patients go into the procedure thinking, yeah, I'm going to have this procedure done by the physician, and they say, no, we're going to have a technician sometimes flown in that day, to have the procedure done by them, because they're the ones that actually have the skill set to do it. So
There seems to be so many problems with that.
Oh yeah.
Especially just imagine you fly somebody in really early. I mean, this is an exhausting procedure, and so
Well, I mean,
just that alone is concerning.
Well, I mean,
But
Clark, it's a medical procedure. The definition of surgery is the removal and manipulation of human tissue, and that's exactly what we're doing. We're injecting medications. We don't do like IV sedation in our office. Occasionally we'll do some oral sedation, but you're also dealing with people's medical histories. I've had a patient recently that went through chemotherapy and has had some medical issues, and has recovered, but we're going to be doing hair transplant, and the physician needs to be involved in the case because bad things can happen during procedures. And the other aspect is that it's almost rare that the doctor does the consult now. It's usually a sales guy or a woman. And
they're trying to sell probably, more for the patient, but that's going to help maybe they have a quota or something. I would imagine. I don't know how that world works.
I
but
mean,
that
potentially, and it's not uncommon that I hear like crazy graft counts. That people say, oh, you need 3,000 grafts. Well, 3,000 grafts is a massive procedure and probably should be even broken up unless there's a donor site that supports it or possibly beard or body hair. But I mean, these are decisions that a doctor needs to be making. And it needs to be the one that's actually doing the procedure. It's no different than if you were getting any other surgery. If you're getting your gallbladder out, you wouldn't want to see a sales guy. You'd want to talk to the surgeon. And when you throw in medications, and it can be a very easy procedure for folks when you numb people right. And I come from a pain management background, so I've become extremely proficient at making the numbing process super easy. I hear horror stories about people almost being brutalized with the numbing. In fact, my patient today had a previous hair transplant, and he said that he was vomiting for hours after the procedure, and probably because he had too much medication injected. So all of this stuff from start to finish, the consult, when patients call my office, they're talking to my team. I don't have people kind of coming and going. I don't have any technicians that I contract with. They're all full-time employees, and they're all really part of getting people educated, getting people's nerves calmed down. There's just a lot of communication that's involved. And then when we throw in my physician's assistants, who are just awesome with great backgrounds, one from emergency room medicine and another from cardiothoracic surgery, they're used to dealing with major, crises and major events. But they have such a soft tone and do such a great job with communication. So they do all, pre-op and post-op discussions, and I get involved as well. And then our technicians have been with me for a very long time, and they do such a great job. So we are talking about Shave-Less FUE, and I think it's not really mainstream because, as I said, doctors are not involved in the consult. They're not involved in as much as you would think or want in the procedure. And it takes a dedicated team and really a dedicated physician to do a Shave-Less FUE and do it right.
With you not only being the founder and physician at this practice, it's got to be comforting to folks who are interested in a procedure like this that you're the one from the very beginning all the way through when you're doing follow-ups and checking in with people. You're there every step of the way, and you've built a team around to support you so you can support your patient. That is, I think, a great highlight to make sure we draw attention to that. Dr. Danyo, they get to work with you the whole time, and you're there every step of the way.
Yes, yeah. And, this is something, hair transplantation is not something that I can do, especially a big case, all by myself. You wouldn't want me to do it all by myself. I mean, we would be here over, a very long period. Because each graft, if we do 2,000 grafts, we're actually touching that graft 4 separate times, technically. We have to core it, we have to pull it, we have to load the graft, into the implanter pens. Then we have to place the implanter pens, and then we have to manage everything, the medications, the numbing, comfort levels, taking breaks, moving the case so it's progressing in an efficient manner, but not rushed, and also executing it to the highest degree, because these grafts are hardy in one sense, but they're very delicate. And if they're not, grafted correctly or implanted correctly, the results can be terrible. I had, about 1 out of 5 of my patients, it almost seems like it's more, are people that have had prior surgery that need a correction. And last week,
that many people.
yeah. So last week, I worked on a great gentleman, and he had the unfortunate event of paying for a hair transplant, and he thought that he was getting 3,000 grafts. That was the plan. And it turned out that he received actually the worst hair transplant I've ever seen. And he's been suffering for 2 years. He's been wearing a hat. He's been isolated, hasn't wanted to go out with friends. And he's a veteran as well, a great guy. And so he came in, and I actually had to remove his hairline. And I only removed 210 hairs, or 210 follicles. That was his hairline. It should be more like 1,000 follicles. They were just spaced randomly throughout his head, into the forehead skin, straight across. And then we drew out another hairline, and he said, "That's what I'm talking about." And we ended up doing 2,500 grafts between taken from the back of the head, and then we took some from the beard. He's going to do great. He's going to do really well. I've spoken with him a couple times since the procedure, and he's just so happy.
Is there a simple answer to how that happens for other people? Is it lack of experience? Is it not a doctor doing it? Is it because that's 1 in 5? That's a lot of people. Those are a lot of bad experiences, and a lot of, like you said, I think the word you used, I don't think it was tormented, but it was they're really hurting from like the psychological impact of that. 2 years, that's really challenging.
Yeah, hair loss is already kind of psychologically purging, and then when you're left with bad results and you've paid money for bad results, and then you have to pay more to correct it, it's kind of like getting an uppercut. But when you're living it, it's like a daily uppercut, and so I think it's really important. If somebody out there is looking for a consultation. And I do recommend that people, talk to multiple offices. I think it's just good to get kind of a range of what's going on. Do your research. But if you make that call and you want to speak with a physician, they say, no, you're going to talk with our sales team. I think it might be something that you may need to possibly think twice about that office, because it is so important to get this done correctly the first time and get the whole process with the team, have the physician managing that team. Again, this is a massive team effort to do it, but it needs to be done right. And, we're talking about Shave-Less FUE, but we've taken it again to the next level. And I think we offer it because I'm involved, and it's been really something that I've been working on for over 10 years. I was one of the first physicians in the country to actually offer it here. And now that we're doing 7 out of 10 of our patients doing shaveless for men, and pretty much 100% of our women are doing it shaveless, it's a great thing. But again, it starts with the consult. And it's very important that you talk to a physician.
Very helpful advice. It's a good tip. And when someone is in the process of asking questions, doing their homework, seeing what's available, when someone does ask you, hey, should I do shaved or shaveless FUE? That's one of the questions you're going to get often. It sounds like just about all women are doing shaveless, and then most men, it sounded like what you just said. What would you say is the answer to a question like that, and how do you answer that why, depending on what you select? This is a common question you're getting, right?
Sure. Yeah. I mean, I tell them the answer to that question is not going to be me answering that question. It's going to be you. And some of the things that go into whether you choose shaveless or shaved is going to be, first, just the economics. Again, we said it's a little bit more expensive, but we've made it affordable. Second, is concealment a massive issue for you? And if it is, then maybe it's shaveless. If it's not, I mean, the way work schedules are, people are working from home, and they're doing Zoom calls, or just they're on the phone and maybe not in the office, and they have short hair to begin with, then maybe a shaved is the way to go. But from a results standpoint, the results are going to be the same. The graphs are the same. It's just the process initially when you leave the office, whether you have a donor site that looks the same as when you walked in, or you have one that's shaved. Because we generally do not shave the whole top of the head. We'll do more like a high fade. And in fact, I'll even do more of a middle fade, because if you go too high, you can look like a jughead pretty quick, I tell people, I think I'll become a barber when I'm all done doing hair transplant, because I do the cuts, and I've got all the guards. I've gotten pretty good at it, and people are like, "Wow, I look good." So I don't want anyone leaving with a bad haircut, and so I think as part of my OCD, it's just something that, for me, doing shaveless and doing the kind of shaved haircuts that I do, in my mind, it honors my patients. I've heard doctors off the cuff say, "What? I just get your head shaved. Just deal with it." That's not a good answer. That's not a good response. People have busy lives, and if we can make this procedure just be a little blip on the radar screen instead of an earthquake, and something that's really time-consuming and negatively impactful, then hey, we have the solution.
I know we talk about how important it is to do it right from the beginning. Someone might, in their homework, they're thinking, you know what? But I've heard of this. People might go to other countries, right, to pursue a procedure like this, and there's some concerns with that. It's really easy to read about something on a website. If you hear about something from somebody, can you share a little bit more about red flags to look out for? I've heard you share
Sure.
how important it is that a physician, a doctor, a licensed medical professional, right? A doctor is doing this. Are there any other stories or examples you've heard of people thinking about, well, maybe I'll go to another country to do something like this?
Sure. I've seen some actual disasters with people going to other countries, and I'm not going to list those countries. It's almost like a fashionable thing to say that they had their hair transplant done in a different country, and kind of the attraction is, well, it's maybe less per graft, but the problem is, because it's less per graft, they end up doing too many grafts and over harvesting, and that is a really, really bad problem when too much hair has been taken from the sides and back. I did a consult recently on somebody who literally had just a rectangle of hardly any hair in full head around, on the top, on the sides, and on the bottom, and then also is not happy with the results, and that's awful. So what we're going to end up doing is actually kind of taking some of the density in just from the top and the sides and the bottom, and actually adding hair back into the donor site, and also kind of trying to fix up what was done to the frontal hairline, which is it looks almost robotic. It's so straight and so perfect, and it's almost too dense because they basically took the donor site and put it up on the head. I think the best option really is to slow down. If you have a huge area to cover, say from the front of the head back into the crown, it's just something that needs to be broken up into multiple procedures. There's no reason to fly to another country because they can do 4,000 or 4,500. I've seen even 5,200 grafts taken before. That is, I don't think it's a smart thing to do. I think it's potentially extremely dangerous because it's such a long case. I've heard of cases going 15, 16 hours before, and it's unacceptable. And it really sets up poor healing in the donor site and increased scarring. So I think if you're looking at doing hair transplant in another country, for one, you've got to do your research and really kind of figure out, is this the right thing to do? And again, speak with a physician. I'd be happy to speak with you as well. I'm not here to talk anybody into anything. I just give advice. But my advice to people listening to this podcast is to be leery. It's not, this kind of new procedure that's, taken over the hair transplant world, and this is the place to go. That seems to be the theme right now, and I just don't think that that's the right mindset to have.
Over the years, the technology has changed, right? And some people might have kind of not the best impression or initial thought of a hair transplant, and it's probably because of what it was like in the past, right?
Yep.
And I understand, like Shave-Less FUE, this is, even though you've been doing this for a decade, that is pretty much near the beginning. And
yes,
hair transplants go on way beyond before that.
Yes.
Is that anything you want to add from that perspective? Because you mentioned scarring and some of the, like, you having to rework things and help people come out of that suffering.
Sure. It's not uncommon, especially with women. They have more of a mindset that this is like a major deal. This is like hair transplant. Oh my gosh, this is too much. It's too big of a procedure.
It sounds like heart transplant. Like my mind, when I think of transplant,
exactly.
I think of like an organ or something.
Well, I think in their minds are thinking about the 80s and early 90s with the plugs and people having kind of a doll's hair appearance, and just unfortunately there's a stigma from that. So it's a very private thing. I mean, the thing with women with the shaveless procedure, and they generally don't have, like, the guys will have like full recession, and then their crown is has hair loss, and so you're literally placing hair on an empty palette, but with for women, the grafts can be concealed in the hair that's still there on the top of their head, and so I think just getting over the mindset that this is a procedure that can be done in a very stealth manner and very private manner is so appealing to my patients, and it's something that I've just kind of crafted an art form for this, because it's not just doing a shaveless procedure. you have to do things so that people don't get a swollen face, don't have a lot of pain. The vast majority of my patients, I mean, we control variables. We can't say completely limit them, but we control them to the point where, the art of concealment is granted. And that involves a shaveless and then no swelling and minimal pain after the procedure.
Well
And that's
said.
not easy to pull off.
Right. You being, not just an artist in that sense, but being a physician. So important. You make that so clear, and I know it's a passion of yours, and I always love to hear and feel that energy that you bring for the work you do. So any final thoughts before we wrap up today's conversation?
I first want to thank everybody that has been listening to the audio podcast. I mean, it's been so well received, and it's awesome doing video now, and looking forward to just putting out some more content. And our mission with this podcast really is kind of fundamental to any relationship that you enter into. And if you know somebody, you like somebody, and you trust somebody, those three things are great. Any one of those that gets eroded, it's maybe affects the relationship. So, my wish with the podcast, especially the video podcast, is for people to know us and hopefully like the content, and possibly trust us as well, or hopefully trust us as well. Yeah,
absolutely. And consultations are available, and I know you've got a beautiful office. You got the new studio. You are full steam ahead to continue doing this work you love. So with that, Dr. Danyo, thank you so much. Really appreciate your time.
All right, thank you.
Hey, thanks for listening to Hair Restoration with Dr. Daniel A. Danyo. Book your consultation today with Dr. Danyo by calling 678-845-7521 or online at nahairrestoration.com. And be sure to follow, rate, and review the show wherever you listen to your favorite podcasts.